Hello everyone, this is your Sahu sir, yet again in front of you. So today I have been with you with a new topic, and the topic is called as health policies in India. So this is the topic which we are going to discuss in economics, right? So what is this health policies in India? What is the importance? We will discuss everything here. Basically, for the economic development, health is a very important because it plays a very important role for the economic development. As you know that we have discussed in the previous topic. Did you remember HDI, PQLI? That is life expectancy rate, standard of living, quality of life. These are also a very important parts under the economic development. So to increase the standard of living, to increase the better quality of life, good health policies has to be introduced by the government. So, what are those policies has been introduced by the government? We will see one by one. Right. So, for the economic development, our government has brought out these health policies in India. So, let us start with the introduction. Let us start with the introduction. Actually, the first health policy in India brought out in the year 1946. 1946, and they used to call it as health survey and development committee. Health survey and development committee first brought out in the year 1946, and next they have upgraded the health policies in the year 1961, and they used to call it as health survey and planning commission. Health survey and planning commission, this is also called as Mudaliar committee. This is also called as Mudaliar committee. So for the development of health in the year 1961, they have created some sort of objectives. They have created some sort of objectives to provide the good health services in all. Under the objective number one is provision of control of epidemics. So epidemics, cholera, TB, typhoid, okay na? These are some sort of chickenpox, smallpox, right? These are polio, some of the various diseases, and these are the very dangerous diseases which is to be controlled, right? This is one of the objective taken out under the health survey and planning commission. Number two, that is called as providing health services. Providing health services means at all levels. At all levels, that is district level, state level, as well as mandal level, as well as in every village level, they want to provide the health services. After that, number third objective is training to employees. Which employees here? Doctors as well as the nurses. They used to provide the training. Most probably in the medical, new innovations has been coming up, and new technological developments, new medicine development is been happening. So related to that, training is being provided to the medical related employees, those are doctors as well as the nurses. So this is the three major objectives which is being carried over under the 1961. Okay, after this many other policies have also been brought out by the government, but most importantly which we have to discuss is, that is, national health policy, national health policy 2017. 2017. So this is the policy which we are going to discuss. Okay, National Health Policy 2017, which is the latest version of all. So under that, okay, they have taken primarily good health services has to be provided, because they have concentrated on good health services as well as well-being, good health services as well as well-being. Okay, so here the government has taken some sort of initiation to provide good health services as well as the well-being in our country. So for that purpose, okay, here the government has taken out some sort of targets, means the NHP, National Health Policy, introduced in the year 2017, and they have set the targets up to 2025. They have set the targets up to 2025 for the good health services as well as good well-being in our country, because in our country poor medical facilities is very much common. There are very poor medical facilities which we used to see it. Generally the poor person, he not able to get the medical services accurately and perfectly, so death rates are more because of non-availability of good health services. So for this the government has taken or set up the targets up to 2025. So what are those targets? Let us see one by one. Right, so target number 1, that is health related expenditure has been increased by the government from 1.15 percentage to 2.5 percentage from GDP. That means from GDP 2.5 percentage of expenditure is allocated to the medical service for the betterment of medical service. This is number 1, increase in the expenditure upon health from GDP. Number 2, they have given out as increase in life expectancy rate. How much they have increased? From 67.5 years to 70 years up to 2025. Of course, the target is up to 2025. Okay, now National Health Policies is taken out in the year 2017, and they have set the policy up to 2025, and they want to increase life expectancy rate from 67.5 years to 70 years. Next, number 3 is reduce reduce total fertility rate. Okay, 2 is to 1. Total fertility rate. Remember in the previous, number of births by a woman during her reproductive period. In the previous already I have discussed this. One check out my previous videos. Okay now. So they want to reduce the total fertility rate. Next, number 4. They have also set the target of reduce infant mortality rate to 28 per thousand live births. 28 per thousand live births. In the previous it is 34 per thousand live births in the previous, but now they want to reduce it 28 per thousand live births. Right. Next, number 5. Number 5 is to reduce, right, prevalence of blindness. Okay na? So after 60 years, the old people, they used to get some sort of eye related diseases. You know it, I think we used to call it as motiabind. Operations they used to carry out. Okay now, operations they used to carry out. In the eyeball, some whitish layer will be formed, and due to that, those old persons, they do not able to see. So this kind of diseases they want to reduce. Okay now, the blindness is they want to be completely reduced. Okay now, next, number 6. Number 6 is increase in utilization of health service. Okay, completely. Okay, around above 50%. Above 50% they want to utilize this increase in the utilization of health services. Most probably in our country the peoples are living in the villages, and they used to have the superstitious, okay na, black magic, that this, okay na, different problems we used to see it, right? And they used to show nearby some sort of ayurvedic or some sort of persons they used to show it, right? Superstitious is very more. They don't visit to the doctors, and due to that number of deaths is also more. But the government wants to create the awareness, and the government is implementing to increase the utilization of health services by people or general public. Okay, next, number 7. It has been taken out as 90% of immunization to be accomplished. Right? Immunization is nothing but vaccination. To whom vaccination? Vaccination to the children's. It has to be taken out around 90% vaccinations to be completed in our country. Right? In the same way, number 0.8. Okay, ensure skilled attendance, okay, at birth above 90% by 2025. Ensure skilled. What is this skilled attendance? Means whatever the deliveries is done, these deliveries has to be done with a specialist doctors. Okay, specialist doctors, the deliveries has to be carried over at the time of birth around 90% and above till 2025. Okay, and next point number 9 is describing as reduce in tobacco use, by 15% till to 2020 and 30% till to 2025. And you know the tobacco related problems in our country, around 10 lakhs per year the people are dying due to the cancer, and the cancer which is being prevailed due to the tobacco. So it want to be get rid of by the government. That is why the government has increasing the tax 200%, 300% tax is more upon the tobacco. Because if the prices are more, then the persons cannot purchase those kind of tobacco and they want to reduce it. Okay now, and next the another one is to provide drinking safe drinking water by 2025. You know, Mr. Narendra Modi has announced a scheme that is called as Ghar Ghar Jal Yojana. Okay na? And in Telangana, you know it very well, Intinti Nalla connection, or we used to call it as Mission Bhagiratha. You remember, right? Under that, at every houses they used to provide the water pipeline connections by the end of 2025, and in Telangana successfully they have been achieved. Okay now, and because it has been very much necessary, most of the people are acquiring the diseases due to the waterborne diseases, and the people not able to get the pure water and they have to travel to distance. They have to travel to a very very long distance, as well as they used to get the polluted water as well as the dirty water. Okay, arsenic, okay, some sort of chemicals are more in the water. Due to that, they used to get various and many diseases they used to get it, which leads to create the problems. To reduce those inconvenience, the government is taken out the steps to provide the safe drinking water at every house. Right. So this is the targets under National Health Policy 2017, which is to be carried out till to 2025. So the government has taken the good decisions and good planning to control the death rates as well as to provide the good health facilities to the general people. Okay now everyone, so this is the topic of National Health Policies 2017. I hope you are understanding. If you have any sort of doubts or any queries or any suggestions is there, please do let me know in the comment section. As well as don't forget to subscribe my channel. More and more videos are coming in the future. Your encouragement is definitely needed to me. Right? Thank you so much.